So let's review some factors that affect cardiac output. First, an increase in sympathetic activity, which may be induced by exercise or fright or nervousness or excitement, causes the atrial or Bainbridge reflex. And that's a sympathetic reflex that is caused by increased venous return. Since the muscles especially are using more blood flow, there's increased venous return to get oxygen and nutrients into the blood vessels. That stimulates the SA node and increases heart rate. That will increase venous return, increase preload, that is, increase the amount of blood left in the ventricle after filling, EDV. That increases stroke volume and thus increases cardiac output. Now, in a fit athlete or a fit person, we see that heart rate goes down, which means that there's more time for the ventricles to actually fill, more time for phase 1 of the cardiac cycle. That increases the amount of blood that returns to the heart, venous return, increasing end diastolic volume, stroke volume, and thus cardiac output. Certain chemicals, meaning neurotransmitters or hormones such as epinephrine, thyroxine, that's T4, or excess calcium, cause increased contractility, meaning stronger contractions of the heart. That decreases end systolic volume, the amount of blood left in the heart, and thus increases cardiac output. And again, you can see here a revamp of sympathetic reactions that increase sympathetic activity, decrease vagal tone or vagus activity. Most of the heart's regulation is by moderation with the vagus nerve and parasympathetic activity. So the parasympathetic system keeps the sympathetic from overloading or making heart rate too strong. And some ionic imbalances can also cause cardiac arrhythmias or problem with cardiac rhythms or filling of the heart. Hypo here refers to deficient or too little. Hyper, too much. Calci refers to calcium. Kali refers to K for potassium. And emia is a blood condition. So hypocalcemia overall causes depression of heart rate. Hypercalcemia causes increased heart rate and increased contractility. Hyperkalemia and hypokalemia both cause alterations of the action potential or electrical activity of the heart, and oftentimes will manifest as dementia on the outside, what you'd see with the patient. So question number 21 is, what is the Bainbridge reflex? And number 22, which you'll need to think about a little bit, how does hypocalcemia cause a decreased heart rate? So I want you to go back and look at the action potential generation in both autorhythmic and contractile cells for the cardiac muscle, for myocardium, and then answer the question based on that cellular and molecular level. Heart rate's also influenced by age. Babies, because they have a tiny little heart, have to do similar amount of work for the size of their body, a proportional amount of work. So their heart rates we expect to be much faster, around 160 to 170 beats per minute. A normal adult heart rate is about 60 to 100 beats per minute. The women, we have faster heartbeats than men. Exercise increases heart rate, and with a higher body temperature, as such would occur with a fever or infection, we also see increased heart rate. Please review these terms. They are simply vocabulary. Tachy refers to fast. Brady is slow. And then when it comes to congestive heart failure, or CHF, with heart disease becoming one of the leading causes of death amongst both men and women as we move into the 20th century here, 21st century, we see that CHF is categorized or designated by 4 big problems. One being coronary atherosclerosis, and that is fat plaques, that's the athero, that clog and harden the coronary arteries, those that supply the myocardium, that weakens it. That cause weakening and atrophy of the myocardium, leading to dilated cardiomyopathy. And in that case, the chambers of the heart become dilated as the muscle gets thinner. Persistent high blood pressure, persistent hypertension means that what little muscle is left has to generate as much force as it possibly can, which taxes the muscle, tires it out, and multiple myocardial infarctions, multiple heart attacks, lead to degeneration of the myocardium and hence dilated cardiomyopathy. So question number 23 is to explain how the 4 disorders listed here individually lead to the overall disease of congestive heart failure. Now, a person could also have right ventricular failure, and that, cor pulmonale as it's called, causes congestion of fluids and bloods in the body organ, edema. You might be treated with Dilantin or Lasix, which are diuretics. More serious, however, is congestive heart failure or left ventricular failure that leads to pulmonary congestion, meaning fluid buildup in the lungs.